Thank you, Kelly. I'm going to go on and we are going to go over today our Get Ready for Go Live checklist, support and resources, our expectations, and then have some time at the end to allow for you all to ask any questions. So let's talk about first getting ready for go live. And I believe most providers have done this, but just want to go back over this again, both if you're using TheraP as your vendor or if you're going to use third parties. So first we're going to talk about if you are using TheraP for your EVV, make sure that you've completed TheraP's JOT form for your agency, that you've scheduled and or had your setup call with TheraP, that you've completed setup of TheraP EVV, including setup of admins, users, as well as the billing if you choose to use the billing option that's available through TheraP, and that you have begun and are on your way to completing the training on TheraP's EVV. So if you're going to use a third party for your EVV, again, that you've completed that JOT form for your agency, you've received those third-party EVV vendor attestation requirements from TheraP, that all of the business associate and end-user legal agreements have been signed and completed, and that you or your third-party vendor has received the aggregator, the API specs, and test access credentials and are currently in or have completed testing. And we do know, I've talked to a couple agencies, I know that you all are still in the process of completing this and your third parties are getting set up, but that you all are planning to be using, collecting the visits in your third party from the start. And we will post this, if Kelly hasn't already said that, she may have. We'll post this deck so that you'll have access to these links. But just reminding you where to find the reports and services. So TheraP has a Kentucky EVV site. All of our town hall meetings that we have had so far are located there. There's another one of those coming up this week. The support material in other languages, specific tutorials by topics, and frequently asked questions are on that website. Your support link to contact TheraP, as well as you can visit the Kentucky EVV website and use that Medicaid public comment at ky.gov if you have questions. If you have not set up or spoken to TheraP, if you please, after this meeting, will send us an email to that Medicaid public comment at ky.gov box so that we can make sure that you get connected. And I believe Kelly also just dropped the link to the Medicaid EVV website as well in the chat. Okay, so what are our expectations for EVV use? So if your agency is a provider for any of the following programs, so Model 2 waiver, home health services, private duty nursing, as well as if you provide home health or private duty nursing through a managed care organization, you are expected to begin using EVV. If you provide those services through a managed care organization, we ask you also to reach out to your MCO for any specific instructions. So as you know, the 21st Century Cures Act is what requires the use of EVV for personal care and home health care services. We've had personal care services in place for some time here in Kentucky. And then, as you know, our go live date for home health is looming quickly on January 1st of 2024. Kelly, we pop back one more to that. We've got the codes listed here. But essentially, it is any of the services that you provide through those three programs, with the exception of any supplies. Of course, you would not have to do an EVV visit for delivering those supplies or providing supplies through either home health or private duty nursing. Kelly, now the next slide. So we do have a soft go live date beginning 12/28/23 for providers to begin using the system. The official go live date is January 1st, 2024. So providers must begin using EVV to capture visit data by 1/1/24. That's either using Therap as your vendor or using your third-party vendor. So we are going to look at a tiered expectation for EVV use. So we would like for providers to be capturing at least 50% of your visits in January, to step that up to 75% in February, and then up to the full 100% in March. Right now, we have the claims editing so that if any visits that are billed in January and February, you will not get denied if there's not a corresponding EVV visit. However, we will capture that information so that we can provide technical assistance to providers to let you know how many would have been denied, as well as a tool to reach out if you are struggling. We encourage you all during this time, if you find that you're having problems, to reach out to Therap, to reach out to us. That 100% is a goal. If we get to February and we're not ready for that 100%, and let me say 100% that is for all the visits to be documented. Do we know there's never going to be a time that all providers are going to, that all of your visits are going to be electronically captured at the time of the visit? We have humans providing this. So we know there's going to be times where somebody forgets to clock in. We know there's going to be times where technology may fail. You know, even though we have other options, we have the offline capabilities, you have the IVR and the web capabilities. There are still times where we may have hopefully not, but natural disasters happen, weather happens. I think we're supposed to have, in some areas of the state, we're supposed to have snow for the first time really this year. So things happen, and we realize that is going to happen. So we will always look at that when we are monitoring compliance, as well as providing, the technical assistance. We're here to help you all. We realize this is a big change. We realize this has happened very fast. Our implementation timeline has been very aggressive. So we just ask that in January, you attempt to have 50% of your visits documented in EVV as best that you can. But again, reach out to us if you are struggling. Let us help you. Let our partners with Therap help to provide assistance if you're struggling. Providers, again, have the option to use Therap for billing. That is not required. So you can continue to bill the way that you do today if you bill through Kentucky HealthNet. If you have a third-party biller, you can continue to do that, and we'll be able to continue to do that moving forward. But there is the option to use Therap to bill those services, and they will provide assistance. They will provide assistance with that and get you set up on what you need to do that to use Therap as a third-party biller. Kelly, if you want to go on to the next slide. So now we are at the time for questions. So again, very brief webinar, just wanted to be able to touch base. I know there was a lot of concern about the percentage of usage and what that was going to look like. And, oh my goodness, are you going to start issuing corrective action plans, beginning in January? No, we're here to help you beginning in January. We need you to, of course, to start trying to use the system as best as you can. Let us and Therap help if you are having trouble with the with connections or with training. But I've seen positive feedback so far from the providers that have went through training. I know there's been lots of good conversations happening between providers and the therapy vendors, as well as on the third party side. I think there's been a lot of positive movement there. I have had at least one provider contact me that their third party is not going to be ready January 1st for the connection with therapy. However, they laid out for me very thoughtfully what their plan is for beginning to capture their visit data in their third party vendor. With the MCOs, again, all of them will be using Therap as their EVV vendor. You again also have the option to use a third party, but reach out to your MCO if you have specific questions related to the implementation from the MCO side. So we have a question about if Model 2 will still be captured using Mobile Caregiver Plus. So at this time, if your agency is using our current vendor for PCS, which is NetSmart, if you are going to use their solution as a third party, then you would use them. However, if they are not connected as a third party vendor, you would need to speak with them to get that connection for the Model 2 services, because they are set to use the Therap solution. So Kim, if you have questions, you can reach out to us separately and we can talk through that.
And just a quick note, I know we have a few people who've kind of sent questions through the chat. If you wouldn't mind, there's a little icon at the bottom that says Q&A. If you put any questions you all have there, that would be very helpful to us as we answer them and to keep track in case we need to maybe do an FAQ or any other kind of, educational, just based on the questions that we get. So, Pam, I will grab this one out of the chat though. There is a question about if you can share a little bit more about how you will monitor on March 1st, 2024. Is it by visit or some type of threshold?
It is. So the monitoring actually will start from January 1st. So we will look at, it's going to be by visit. So we will look at, and we will compare the number of visits that are logged in or that are in the EVV system with the number of visits that have claims against them. So it is by visit.
Okay, and we have one more question about, can you clarify whether MCOs will be handling EVV the same?
So I don't want to speak for any of the specific MCOs. But essentially the functions are the same of what you need to do, but really want you to reach out to your specific MCO. But we've worked with them to try to have a consistent practice across the board, so that you won't have to have multiple different processes depending on which payer that you have, whether it be us for fee for service or you have worked with multiple MCOs. And again, just to mention, there are with the logging of the visits, there is the mobile device option, there is the voice response or the IVR, as well as a web-based option for checking in and out of visits.
And then we also have just one more question. Can third-party systems send both MCO and fee-for-service visit data to the Therap aggregator?
They should be sending both. Ultimately, the Therap aggregator collects the data for fee-for-service and for all of the MCOs. Is claims monitoring the same for MCOs and fee-for-service? The MCOs the feed for them to match the claims goes in just a little bit later. But it will ultimately, they are required to monitor the same and report the same information. It just will be the start date will of any editing will be later, because that file to be shared with them with the visits will not be in place at the beginning in January. But their monitoring is the same. It will look for the visit and the claim. And we did allow something that's different from home health, is that you all are actually putting in your members and your prior authorizations. The reason that we chose to do this for home health is, there are times where you may have someone, you may know of someone that's getting discharged from the hospital, maybe on a Friday, and you don't have time to get that prior authorization in place before they go home, but you need to do visits. So this allows you to put that information in the system so that you are able to do those visits over the weekend or during that evening, as well as we know that eligibility can change periodically, and this allows you to be in control of those individuals. There still will be the edits on the claim side, so that a member still has to be eligible, and there does have to be an authorization approval in place. But many times you all know if it is going to be approved, and if you need to go ahead and see that individual. So letting you be in control of putting that information in the system allows the individuals to be seen quicker. Do personal care agencies continue sending to NetSmart until summer 2024? So there is not a specific date yet for any transition, but you do continue with personal care services with NetSmart as you have done, as you're doing today and have been doing. You will continue to operate that way until you're giving instructions otherwise. And I do know we have at least one agency that is using that NetSmart is going to be their third-party vendor for HHCS services. So, and I know that they have completed their process of onboarding. So you would, if you choose to select NetSmart as your third party, you will. They're familiar with the process. As I said, I know they're already on board for one provider, but you would just reach out to them and they can help you through that if you would like to use them as a third party.
I do not have any other questions in the chat, Pam. Oh, here comes another one, Q&A though.
Do you intend to change any billing processes in the future, or will agencies be able to bill the way they always have? So we are not going to change the billing processes. You have the option to use Therap as a third-party biller, and they can, our Therap team can go over that information with you and how you do that and get set up to do that. If you choose to, if you already have a clearinghouse or a third-party biller and you choose to continue that, or you want to continue billing through Kentucky Health Net, you will still be able to do that. So there's not a mandatory way that you will have to bill. We will be sharing the information. The visits from Therap will be shared with the MMIS for them to compare any claims against that for a corresponding visit before the claim is paid. Can you repeat what you said about home health agencies being able to enter patient information while waiting for an author eligibility? So yes, so the home health agencies are able to, you will be in control of entering who the individuals you are serving are, as well as their prior authorization for services. So if you know that an individual, say they're getting discharged from the hospital on a Friday, or there's a delay in a prior authorization that you've submitted being processed, but you need to see the individual. Because that authorization is a critical part of you being able to do the visit, you will be able to enter that information as the home health agency that is serving them. There will still be a matchup that, if for some reason the individual does not become eligible, or if the prior authorization is different, say, for example, you put in 50 visits, which I know that's just a number, an unrealistic number, but you put in 50 visits and ultimately they were only approved for 30 visits. So it's not going to pay based on the authorization that you enter into the TheraP system. So you'll still need to match that up with what you're ultimately authorized for. However, it will allow you to go ahead and see that patient while you're waiting on that authorization to be processed. And so if you, as you complete your onboarding with TheraP, there are resources as well as they can help you to with any questions about how you will do that. When hard denial begins in March, please confirm that providers can still have a workflow for corrections. For example, retransmit any rejected visits from their third-party system. So yes, and right now the hard denial is targeted for March. However, again, I want to stress we're going to evaluate how things are going up to that point. And if we are not ready when March comes, then we will talk about that with providers. So we will let you know before that change occurs. But yes, you will have the opportunity to correct visits, maybe if there was somehow a visit got missed, that information didn't get put in, you will have the ability to put that information in the system, so that you can get paid for that. You will not miss being able to bill that visit. Again, I really want to encourage you to reach out to the TheraP team. And if you're having any difficulties or have specific policy questions, to the DMS team. After go live, you will be able, similar to how you're able to do today, you will be able to contact our help desk, and those staff will have individuals that they can escalate questions to, but they can take down information for you. If they don't have the answer, they can capture that information for you and either connect you with someone at TheraP or with our DMS team that can answer those questions for you. So really, we're here to support you, and as we get things started. We realize it's a little, there's anxiety there, which is expected. It's a new process. As I said, it was a very aggressive timeline. I want to thank the providers for engaging and for reaching out and onboarding with TheraP in a timely manner. And again, it's just important to keep the communication open. Let us know if you're struggling. Let us know what you like. I mean, if you see things that are really helping, also let us know that, or if you have suggestions on things that could be done better. Please just keep the communication open. That's the most important part.